Do you suffer from hypertension or benign prostatic hyperplasia? If so, you may have come across the medication Doxazosin. This powerful drug has gained popularity in recent years for its multiple health benefits. In this comprehensive guide, we will unveil the potential of Doxazosin, exploring its uses, warnings, and long-term effects. Whether you are a patient considering Doxazosin as a treatment option or a healthcare professional seeking a comprehensive overview, this video provides valuable insights to make informed decisions. What is Doxazosin? Doxazosin is a medication primarily used to treat hypertension, also known as high blood pressure. It belongs to a class of drugs called alpha-1 blockers, which work by relaxing the blood vessels, allowing blood to flow more easily. This helps to lower blood pressure and reduce the risk of cardiovascular complications. In addition to its antihypertensive properties, Doxazosin has also been found to be effective in treating benign prostatic hyperplasia, BPH, a condition characterized by an enlarged prostate. Medical uses of Doxazosin. As mentioned earlier, Doxazosin is primarily used to treat hypertension. High blood pressure is a common condition that affects millions of people worldwide. If left untreated, it can lead to serious health problems such as heart disease, stroke, and kidney failure. By lowering blood pressure, Doxazosin helps to reduce the risk of these complications and improve overall cardiovascular health. In addition to its use in hypertension, Doxazosin has also been found to be effective in the treatment of benign prostatic hyperplasia, BPH. BPH is a non-cancerous enlargement of the prostate gland that can cause urinary problems such as frequent urination, difficulty starting and stopping urination, weak urine flow, and the feeling of incomplete bladder emptying. Doxazosin works by relaxing the muscles in the prostate, leading to improved urinary flow and alleviating the symptoms associated with BPH. How Doxazosin works in the body. To understand how Doxazosin works, it's important to first understand the role of alpha-1 receptors in the body. These receptors are found in various tissues, including the blood vessels and the prostate gland. When activated, they cause the blood vessels to constrict, leading to increased blood pressure, and the muscles in the prostate to contract, contributing to the symptoms of BPH. Doxazosin blocks these alpha-1 receptors, preventing them from being activated. By doing so, it relaxes the blood vessels, allowing blood to flow more easily and lowering blood pressure. It also relaxes the muscles in the prostate, improving urinary flow and relieving the symptoms of BPH. This dual mechanism of action makes Doxazosin an effective treatment option for both conditions. Potential side effects of Doxazosin. Like any medication, Doxazosin can cause side effects in some individuals. Common side effects include dizziness, drowsiness, headache, nausea, and fatigue. These side effects are usually mild and temporary, and they tend to improve over time as the body adjusts to the medication. However, if these side effects persist or worsen, it is important to consult a healthcare professional. In addition to the common side effects, Doxazosin may also cause sexual difficulties in some individuals. This can include erectile dysfunction, decreased libido, and difficulty ejaculating. If you experience any of these symptoms, it is important to discuss them with your healthcare provider. They may be able to adjust your dosage or suggest alternative treatment options. Warnings and precautions for taking Doxazosin. Before starting Doxazosin, it is important to inform your healthcare provider about any pre-existing medical conditions or medications you are taking. Certain medical conditions and medications may interact with Doxazosin, potentially increasing the risk of side effects or reducing the effectiveness of the medication. For example, Doxazosin may interact with medications used to treat erectile dysfunction, such as sildenafil, Viagra, tadalafil, Cialis, and vardenafil, Levitra. Combining these medications with Doxazosin can cause a sudden drop in blood pressure, leading to dizziness, fainting, and other serious complications. Additionally, individuals with liver or kidney disease should use caution when taking Doxazosin, as the medication is primarily metabolized by the liver and excreted by the kidneys. Any impairment in liver or kidney function may affect the body's ability to process and eliminate the drug, potentially leading to an accumulation of the medication in the body. Long-term effects of Doxazosin. While Doxazosin has been shown to be effective in the short-term management of hypertension and BPH, its long-term effects are still being studied. Some research suggests that Doxazosin may have additional benefits beyond its primary indications. For example, studies have shown that Doxazosin may have a protective effect on cardiovascular health. It has been found to reduce the risk of heart failure and improve overall cardiovascular outcomes. This may be due to its ability to relax the blood vessels, reduce arterial stiffness, and improve blood flow. In terms of prostate health, long-term use of doxazosin has been shown to help prevent the progression of BPH and reduce the need for surgical intervention. It can also improve symptoms such as urinary frequency, urgency, and nocturia. Dosage and administration guidelines for doxazosin. The dosage of doxazosin will vary depending on the individual's condition and response to the medication. It is typically started at a low dose and gradually increased as needed. The medication is usually taken once daily, preferably at bedtime, to minimize the risk of dizziness and lightheadedness. It is important to follow the prescribed dosage and administration guidelines provided by your healthcare provider. Do not stop taking doxazosin without consulting your healthcare provider, as suddenly stopping the medication can cause a sudden increase in blood pressure. Alternatives to doxazosin for treating the same conditions. While doxazosin is an effective medication for treating hypertension and BPH, there are alternative treatment options available. For hypertension, other classes of medications such as diuretics, beta blockers, and ACE inhibitors may be prescribed, depending on the individual's specific needs and medical history. In the case of BPH, other alpha-1 blockers such as tamsulosin and alfuzosin may be used. These medications work in a similar way to doxazosin and can help alleviate the symptoms of BPH. It is important to discuss the available treatment options with your healthcare provider to determine the most suitable option for your individual needs. Frequently asked questions about doxazosin. Is doxazosin safe for women? Doxazosin is primarily prescribed for men with hypertension or BPH. While it can be used off-label in women for certain conditions, it is important to consult a healthcare provider for personalized advice. Can I drink alcohol while taking doxazosin? It is generally recommended to avoid excessive alcohol consumption while taking doxazosin, as alcohol can worsen the side effects of the medication. Can doxazosin be used in children? Doxazosin is not typically prescribed to children. The safety and effectiveness of the medication in pediatric populations have not been established. How long does it take for doxazosin to work? The onset of action of doxazosin can vary among individuals. Some may experience a noticeable improvement in symptoms within a few days, while others may require several weeks of treatment. Conclusion: understanding the benefits and risks of doxazosin. Doxazosin is a medication with multiple health benefits, particularly in the treatment of hypertension and benign prostatic hyperplasia. It works by relaxing the blood vessels and the muscles in the prostate, leading to improved cardiovascular health and alleviation of urinary symptoms. While doxazosin offers promising results, it is important to be aware of its potential side effects and warnings. Dizziness, drowsiness, headaches, and sexual difficulties are among the possible adverse reactions. It is crucial to discuss any pre-existing medical conditions or medications with your healthcare provider before starting doxazosin. In terms of long-term effects, doxazosin has shown promise in protecting cardiovascular health and preventing the progression of BPH. However, further research is needed to fully understand its impact on these conditions. If you are considering doxazosin as a treatment option, it is important to follow the prescribed dosage and administration guidelines provided by your healthcare provider. Additionally, explore alternative treatment options and discuss them with your healthcare provider to determine the best course of action for your individual needs. By understanding the benefits and risks of doxazosin, you can make informed decisions about your health and unlock the potential this medication holds in transforming lives and improving health outcomes. Thanks for watching.